Hello everyone. Today we will discuss on HOT application. Myself Anusha Anand, working as a tutor in M College of Nursing. Objectives. At the end of this section, we will able to define HOT application, its purposes, classification, physiological effects, contraindications, principles, complications, and general instructions. Introduction. Thermotherapy is the use of heat to treat symptoms of acute or chronic pain, especially those related to muscle tension or spasms. It is also a common treatment for arthritis, tendinitis, back pain, shoulder pain, and other kinds of joint pain. HOT application results in an increase in molecular vibration and cellular metabolic rate. Definition. HOT application is the application of a hot agent warmer than skin, either in a moist or dry form on the surface of the body. Purposes. HOT application has various purposes. It decreases the pain, it provides comfort, to promote the circulation, to relax muscles, to promote healing, to relieve deep congestion, to stimulate peristalsis, to counteract sudden drop in temperature, to decrease joint stiffness, and to relieve bladder distension. Let's see the classification. It has been classified into two forms, that is local and general. Local, again it is divided into dry heat and moist heat, and general, that is also divided into dry heat and moist heat. Local. In local it is divided into dry heat and moist heat. Dry heat. Examples are hot water bottles, chemical heating bottles, infrared rays, shortwave diathermy, heating lamps, electric kettles, and electric heating pads. All these comes under the dry heat. Warm soaks, hot fomentations, tubes, paraffin bath, sitz bath, and ecothermia pad. These all comes under the moist heat. General. In general, again it is divided into dry heat and moist heat. Sun bath, electric cradles, and blanket bed. It all comes under dry heat. Steam bath, hot packs, and whirlpool bath comes under the moist heat. Physiological effects. Physiological effects, it's divided into primary effect and secondary effect. So let's see in primary effect. Primary effect, it affects on the peripheral vasodilation, increased capillary permeability, it increases the local metabolism, it increases oxygen consumption, blood flow is increased, blood viscosity is decreased, lymph flow is increased, motility of leukocyte is increased, muscle tone is decreased. So these all comes under the primary effect. Let's see the secondary effect. The primary effect of HOT application may last only for 20 to 40 minutes. After this time, the heat application must be discontinued and recovery time of 1 hour allowed. Otherwise, secondary effect will take place. Contraindications. There are various contraindications in HOT application. Heat is not used because heat increases the metabolism. Heat is not used for the patient with impaired kidney, heart, and lung function. Heat should not be applied to acutely inflamed areas, example acute appendicitis and tooth abscess. It should not be applied on patient with paralysis, weak and debilitated patient. It should not be applied when there is open wound and bleeding. It should not be applied where there is edema associated with venous or lymphatic disease. It should not be applied on patient with metabolic disorder. Example, patient with diabetes, atherosclerosis. It should not be applied on patient with high temperature. Hot application works on various principles. It causes dilation of blood vessels and increases the blood supply to the area. It stimulates metabolism and the growth of the new cells and tissue. The end organ of the sensory nerve in the skin convey the sensation of heat. The sensations are interpreted in the brain. Water is a good conductor of heat. The flow of heat is from the hot area to the less hot area. Presence of stream increases the temperature of the hot application. The temperature tolerance varies with individual and according to the site and area covered. Friction produces heat. Complication. The complications are pain, burns, maceration, redness of the skin, edema, hypothermia, and pallor. General instruction. Check a patient frequently during hot application. The condition of the skin indicates whether tissue injury is occurring. Do not allow a patient to adjust temperature settings. Never position a patient in such a way that he cannot move away from the temperature source. This avoids the risk of injuries from temperature exposure. Never ignore the complaint of a patient, however small they appear to be. This is all about my topic. See you soon with more interesting topics. Thank you.